be here in the background.
Fabulous.
Lovely. Thank you.
Thanks so much, Claire, and thank you, Jackie, for starting the recording. So it's a real pleasure to be here today. Thank you to Jackie for inviting me along. As Claire's already said, I'm going to be talking to you about education for sustainable healthcare within UK pre-reg curriculum for AHPs, bit of a mouthful. I'm a paediatric physio by profession, and I was on the Chief Sustainability Officer's Clinical Fellowship Scheme last year. So the cohort before Jackie, and I've been very fortunate to be seconded for a further year onto a senior fellowship scheme. So still working on all things sustainability, but I'm working for an ICB in the east of England. So it's a pleasure to be able to present this piece of work that I did as part of my original fellowship, working very closely with the CAPO office in England. We should have plenty of time at the end of the presentation to take questions. I don't think I'll go for 30 minutes because I get really bored by the sound of my own voice. So I'll whistle through it fairly quickly, and an opportunity for people to ask any questions they've got. So I'm just going to be providing a bit of an overview of the document that we developed, just sort of starting by discussing why incorporating environmental sustainability is important in allied health education. I'm assuming that everybody here is probably in that same echo chamber, and hence you're here. So hopefully I won't have to do too much convincing. Then just going to go through a little bit about the timeline of how we developed the document, a bit of a structure and overview of the document, talk a little bit about the patient voice, and then just give you opportunity to ask questions, but also to provide feedback on the document at a later point, if and when you're able to have a look at it, because it's very useful for us. So we're going to kind of try and focus really on how you might use it, sort of the crux of it, how you might use it, depending on where you work in the system, whether you're an academic or a student or a practice-based educator, for example, because hopefully there's something in there for everybody. So as we all know, the climate crisis is a health crisis, but it's also really important to point out that the decision to produce this document and others in the system like it wasn't actually a top-down decision. In fact, it was the converse, that whilst sort of large multinational organisations, as you'll see from a few of the examples on this slide, have been calling for the inclusion of planetary health and environmental sustainability in healthcare education, there's been sort of equally, if not greater, pressure from students and learners, which is fantastic. And the talk after mine, we'll be hearing from some of those and what they're doing about it. And it's amazing to see that students and learners are really demanding to be taught about the climate crisis and planetary health as part of their curriculum. So it's pretty important that we, as qualified professionals and academics, know what to teach them and how to teach it. So I think it's sort of fair to say that the momentum started largely in this space with medical schools and medical students, but as you'll see again from the session after mine, this momentum has happily snowballed and it's reached the land of AHP. So we've got a call to action now, sort of really widespread from students from multiple healthcare disciplines involved in the Planetary Health Report Card. And I guess just the bottom line, which hopefully everybody here agrees with, is that sustainable healthcare really is just good healthcare. It's good for our patients, first and foremost. We're not doing this at the detriment of patients. We're not choosing environmental sustainability over good patient care. It enhances patient care. But it's also good for staff. It's good for the health of the public and the population. And obviously for the environment on which we depend heavily, because we wouldn't be here without it. So on to a brief look at the timeline for the development of the document. So the seeds were sort of first sowed in autumn, winter 2022, when I first started in my clinical fellowship role. And we had sort of numerous conversations with a variety of stakeholders. So that was across the UK, and that included professional bodies for all of the kind of AHP professions, various academics across lots of institutions, clinicians, particularly practice-based educators, students and learners, the Council of Deans of Health, and also importantly our regulator, the HCPC. And it soon became clear that people wanted guidance on how to do this. So people were recognising the importance of it, but wanted to understand what fundamental areas of planetary health they should be including in healthcare programmes, but also how they should be delivering it, and how this was sort of specific and applicable to AHP education, rather than medical education, because obviously there's some stuff already in the system around medical education, but AHP education is a little bit different. So whilst sort of some stakeholders viewed this as more or less important, nobody disagreed with the principle. So the next step was to try and get the 4 UK CAPOs, so Suzanne Rastrick in England, and then her equivalents across Wales, Northern Ireland and Scotland on board. And thankfully, all of whom gave their very full support. And the Council of Deans of Health then kindly agreed to take on the endorsement and publishing role, which is fantastic. So they're sort of the voice of UK universities. So we then began some recruitment to try and get a small but very representative advisory group. So that included the HCPC, it included some of the professional bodies, it included experts in sustainability across the kind of health piece. So UK HAC, for example, the Greener NHS, Centre for Sustainable Healthcare, very importantly, academics and students. So we had about 15 people on the advisory group to cover all of those bases. And then in March, we had our first meeting. And what we did was we decided to distribute an academic survey. So this, again, was sort of supported by the Council of Deans of Health, and we sent it to UK universities in all of the 4 UK nations, really just with a set of questions, trying to understand and baseline what the current provision was from an academic point of view of kind of course leaders in AHP courses. We also wanted to try and understand if there were any enablers. So if people were doing this well, how were they doing it? How were they finding it? And barriers. And I guess thoughts about what they needed, perhaps examples of current practice, all that kind of thing. So we distributed that all in March last year, and then did a whole bunch of desk-based research to find out what was already in existence. And as I said before, a huge amount of the information that was already out there was among kind of medical professions. So they were sort of leading the way, but quite specific to medical practice. So we really felt that there was a bit of a gap and a bit of a hole that needed filling for AHPs. So after we'd identified sort of what frameworks and guidance currently existed, we sort of brought that all back together. And so together with the results of the academic survey, we then sort of analysed that to really try and pin down what was needed together with the advisor group, and that sort of shaped the first skeleton iteration of the document. So by June, we then thought, well, what we're missing here, apart from on our advisory group, is we haven't got a really big student voice. We really want to hear what students want to learn about. What do they think that they need to know? What should they be being taught from their point of view? So we then collaborated with some wonderful colleagues at Oxford Brookes University, one of whom you'll hear from in the next section on the planetary health report card. And one of their students had already distributed, as part of her dissertation project, a survey to a small group of AHPs about planetary health. So we scaled this up and then widely disseminated that again to all sort of 4 corners of the UK to get feedback on what students and learners really wanted. So we then kind of got the feedback from the first iteration of the document, gathered that together with the information from the surveys, formed a second iteration, and then by September time, we'd kind of come onto our more or less final version that then got circulated for comment, with final sort of edits and quality assurance from sort of a small group of partners. And I guess all the way along, whilst we had a sort of a fairly small advisory group, there was lots and lots of ad hoc work going on with some really significant other contributors sort of along the way, either through kind of focus groups or one-to-one sessions, meetings, presentations at pre-existing forums. So it was a fairly comprehensive, fairly quick timeline, but fairly comprehensive and robust process. So this is a glimpse of the sort of the overarching model. And this is the QR code to go directly through to where it's hosted on the Council of Deans website, and it's in the presentation a few times. So you'll see in the centre, I appreciate it's a bit small on the slide, but just to give you kind of a flavour. So in the green in the centre of the graphic, what we've sort of broken down and described as the 5 foundations of planetary health and sustainable healthcare. And this, as I say, was gathered from all of the literature that we could find in terms of what was already out there in medical curriculums, what people thought was important, what the learners thought that they needed, what academics thought they should be teaching on. And we made it into these kind of 5 principles or foundations of planetary health and sustainable healthcare. And then around the circumference, so that those 5 make up that kind of planetary health literacy. And then around the circumference, we then came up with principles of how to incorporate it into the curricula and into programmes. And we'll cover this in more detail in subsequent slides, but for now it's just sort of to set the scene of how we've structured the document. And I wanted to make it pretty, so I made it into a sunflower, much to the chagrin of some of the people in the greener NHS who are a bit more corporate than I am. So onto the document itself. So we then made a decision to try and chunk it up a bit because, as you can imagine, based on the scale of the problem that we find ourselves in, there's quite a lot of information to include. So what we endeavoured to do is to try and make it user-friendly, so a bit more of a kind of dip in and out resource or guide rather than something that you'd sit there and read cover to cover, because nobody's going to do that. No one's got time to do that. And this is sort of supported by the formatting. It's got kind of hyperlink content. So if you want to go straight to the what, you can kind of click on that from the contents page. So the first section includes the background, the policy, the mandate. So what are all of our kind of current legal and kind of mandates out there, just to kind of strengthen the argument for why we need this. The current position across professional bodies, so who is doing this already, who is supporting this already, and then kind of across academic institutions, learners, higher education. So it's also kind of got the headlines from the surveys that we conducted as well within section 1. The second section of the document is the really nice meaty bit. I shouldn't say that on a environmental sustainability, veggie bit. And this covers the what and the how. So this is the kind of the bit that really speaks to the model that we've designed. So we broke it down into, as I said, the 5 foundations of what, and then the how, the 6 main principles, just so that people could really think about how practically to apply this topic into curricula and courses. Because obviously, what I didn't say at the beginning, whilst this has sort of been designed heavily to think about how to include it in for course leaders, it's also really a bit of a push to our colleagues in professional bodies to say this also needs to be on your curriculum. This can't just come bottom up from learners and from course leaders who are interested in incorporating it. This also needs to come top down. You need to be setting this within your curriculums. So whenever you come to do curricular refresh, this needs to be in there. So we're kind of looking at those 2 audiences. And then throughout, sort of where appropriate, there's lots of signposting to really, really key resources or further information or training and references. And then the final section is quite a big piece of work in the appendices. So it includes the conclusions, a very extensive reference list from all that desk-based research that we did, and also some really great examples of good practice, because that's what people were telling us they wanted, not just how we thought that they should do it, but also are institutions doing it already? If they are, we want to see what they're doing. So we've got some good examples, both from professional bodies who have already included it in the curricula, but also from academics within HEIs, and also the results of the full results of the survey as well, and all the kind of frameworks that we reference within the first section around the mandate. So as I said, we break it down into the what and how, and we put them into separate graphics just to make that easier for each of the separate sections. So again, apologies that this text will be really small, but if you go to the document itself, obviously it'll be a little bit easier to read. But just in summary, this first sunflower describes the 5 foundations, or the what, to include in curricula and programmes. And this, as I said, was all gathered from the literature, from experts in the advisory group, and from any of the frameworks that are currently in existence. So starting at the centre of the sunflower is the concept that before anything else, learners have to have a robust understanding of what planetary health is. That's a kind of an appreciation of the interdependence and inextricable links between nature, health and humans, how we cannot separate ourselves from any of those three things. They have to come together. And thereafter, each of the quarters then explore an aspect of sustainable healthcare within the context of planetary health. So that includes the health impacts of environmental degradation. So how is human health impacted by environmental harms? Because it's pretty important when you're teaching on a health course that you're able to understand this and translate that to students and learners, and they understand. Then the impact of healthcare on the environment. So what are we doing within healthcare that is resulting in further harm to the environment and perpetuating the health impacts of environmental breakdown on our population? Because we need to all take accountability. Every single thing we do within healthcare has an environmental impact. Thirdly, having a look at what sustainable clinical practice is and what it should be. And, you know, pleasingly within the AHP world, we are already doing lots of sustainable clinical practice. There's loads of great examples that you'll have seen throughout the course of this Action Pack week, but there's always more to do. And then finally, how as AHPs, we have a responsibility to be environment and health advocates. We've got to be able to advocate for good health without causing further harm to the environment and to our populations as a consequence. So I'm just going to use one example foundation just to describe in the document how we've presented the information. So I've chosen Foundation 2, which is the health impacts of environmental degradation on social and environmental determinants of health. So each foundation sort of starts with a basic background, including the evidence base. Then where possible, we've tried to focus on specific applicability to AHPs before then giving examples within the context of health and care. So here we just designed this diagram. Again, it'll be too small for you to read, but just illustratively, as heat waves an example of climate change, an effect of climate change and the subsequent health impacts on humans. So this is, of course, one of hundreds of possible scenarios to illustrate where AHPs might come into contact with patients or populations whose health are being impacted by the effects of climate change. So it could just be used really as a starting point for each profession to identify where they might see this patient. So, for example, a paramedic attending a call out to an elderly person having suffered heat stroke and fallen at home. They then might meet a radiographer, fire attendants in A&E. They then might unfortunately have to go through to theatres and encounter ODPs there because they need surgery to fix a broken hip. They then might see a speech therapist and dietitian on the ward to assess their hydration, and then a physio for rehab, etc., etc. OTs, you know, to facilitate the discharge with sort of equipment, etc. So you can see where just using one example throughout can kind of cover the lots of different AHPs. So hopefully that sort of serves as an illustration of kind of how the human health and environment break down and are inextricable, and how as AHPs will come into contact with patients suffering health impacts. And then lastly, as I said, at the end of each foundation is a resources box. So it's got a bit more explainer text in the document, but just that draws your attention to some of the key texts and resources, any further training that's available, sort of freely available online, or that, you know, academics, learners, clinicians alike might find useful. It's obviously, this agenda isn't fast paced, so hopefully we'll be able to kind of regularly go back into the document and update it if things need to be added or taken away. So the second bit is the how. So this is the bit that hopefully the academics in the room, I won't be teaching to suck eggs here, but this is what people said that they wanted. So this just describes the sort of the 6 principles of how to include the material, or suggestions of how to include it within curricula and in programmes. And again, gathered from published literature, from frameworks and guidance from academics and learners. So we felt it was important to kind of qualify each of the principles for completeness. So the 6 principles we've got around the edges are ensuring that the material is woven throughout curricula as sort of a golden thread, rather than as a standalone or additional teaching, because that's some of the things that we heard back from the academic survey and from the student survey, that it was like, oh, we do it, but it's a one-off teaching. We get someone external to come in and they do it for an hour and that kind of ticks the box. Well, we know that's, you know, if you think about the other things like EDI, quality and diversity, for example, we know we have to thread that throughout everything, because this is part of everything we do. So the second bit is sort of second and third really, is ensuring that there are really robust learning outcomes and assessment to test them, because it's all very well teaching about it, but we know, having been students ourselves, that if you're not going to be examined on something or assessed on something, you perhaps don't dedicate as much time to learning about it. So kind of a little bit of a push for people to you know, to if you've got learning outcomes and you know that there's assessment, then you kind of apply your learning better. And again, that was academics that was telling us that. And then sort of fourthly, we recognise that the subjects are really complex, so kind of nurturing that systems and critical thinking in order to embrace complexity at pre-reg level. so that graduates are entering into what is an equally complex healthcare system with a really full appreciation of the problems, to give them a head start in sort of identifying mitigation or adaptation solutions to these really wicked problems that we're facing. And then recognising that this is a really great subject for interprofessional learning. And so really encouraging collaboration across disciplines, really to promote that kind of collective thinking. It obviously really mirrors teamwork and encourages synergy as well, across the MDT. And then finally, but obviously very importantly, ensuring that learner education and educator well-being, learner and educator well-being is a really high priority, and that there's a focus on the co-benefits of climate action, and also that there's sort of resources and signposting readily available to support eco-anxiety, because we know that when we discuss this very emotive stuff, that is likely to be a response for many of us. So making sure that there is facility within institutions or organisations to support learner and educator wellbeing. So similar to each of the foundation areas, I've just used one principle as an example of how we've tried to systematically present the material in the guidance. So in this instance, again, I've used principle 2. This one is around learning outcomes. So each principle starts with the evidence base in the background. And then for learning outcomes, for example, we've tried to reference any that we've found in existing frameworks in other areas of healthcare. So for example, in medicine, that have got kind of generic learning outcomes that could apply across most areas of healthcare or could be used or adapted for use in the AHP curricula. So again, in this very tiny table, if you've got good eyesight, then you're doing well. So sort of some of the more generic stuff that can cross over all kind of healthcare disciplines. But then we've included some more specific learning outcome examples, and these have come from colleagues in HEIs when we sent out the survey or through discussion. And there's kind of links to more of these in the appendix. So these are just a couple that I've pulled out. So you can see from the top table those kind of outcomes that might be applicable across several professionals. So for example, demonstrating the ability to take an environmental health history within a patient consultation. Whereas then the example in orange is a bit more specific to AHP professionals involved with rehab, for example, and the same for kind of the example below. So just really trying to back up and give examples. Obviously, these will need finessing according to your cohort of learners and what HP professional you're teaching, but just to kind of give a bit of a flavour, but not teaching you how to suck eggs, because I did get told that several times. So within the last section of the document, so there's not only the comprehensive reference list, but also some really valuable resources in the appendices. So in addition to the full survey results, we've got a table of, sorry, again, really small, but a table of kind of policy and legislative documents. So that's up. So we've got the kind of guidance frameworks tools where we took lots of this information from in the top left-hand corner there. But we also, what we did was created a table of sustainable AHP practice examples, and these were gathered from all of the 14 AHP professional groups, from clinicians, from academics. It's not an exhaustive list, but it was just to try and give some tangible examples of sustainable AHP practice that already exists. And we've grouped them by kind of, for example, prevention, health promotion, lean pathways, carbon, low carbon care. So those kind of principles of clinical practice. So hopefully there's something for every profession within there that they'll be able to recognise, just to kind of, again, get people started really. And also within the appendices, we've got some examples from professional bodies or royal colleges who've already started to include sustainable healthcare into their curricula. They're not exhaustive, but some of our colleagues, so the Royal College of OT and the Society and College of Radiographers and the BDA, the British Dietetic Association, has already got elements of sustainable healthcare within their curricula. So hopefully that kind of just gives other professional bodies a little bit of guidance, a bit of a push. And we know that there's quite a few professional bodies that are either refreshing their curricula this year, like the CSP is, or in the next couple of years. So hopefully this will be useful guidance for them in terms of working out where to fit things in, to their curricula, because we need that top down, as I said before. We need that kind of mandate a little bit from professional bodies to support educators in academics into how to incorporate things into their programme. So be pleased to hear that I'm going to stop talking. And this slide is just, we have got a kind of a survey. So if any of you do go on to have a look at the document or use it, if there's any opportunities to leave any feedback, would be really, really grateful, because it's hopefully an iterative document that we're going to continue to update, because this, as I said, this world is moving very fast paced in this space. So yeah, any or if you've got anything that you want to kind of send to me separately on email, any questions or anything, then really, really happy to answer those. So I'm going to stop sharing and hand back to my wonderful chair, Claire, and see if there's any questions.
Thank you so much, Jessie. No, it was so interesting. So